There could be major problems happening inside your mouth that you're not even aware of. Pay attention, this could be you. Now, you may well have an impeccable record of dental health. You may brush and floss twice a day. You could be the veritable poster child of good oral health. And yet your perfect teeth may well be in danger of cracking and falling apart, all because of what happens when you're not even awake, it's not even within your conscious control. Dentists are urging people who grind their teeth or clench their jaws while they're in blissful slumber to see their dentist sooner rather than later, because there's a lot of people wearing down their teeth without knowing it and causing permanent long-term damage. Teeth grinding, it is very much a thing. Dentist Dr Adrian Kat is my guest to explain a little bit more about the condition. Its real name is Bruxism. Dr Kat, good morning. Welcome. Thank you so much for your time.
Hello. Thanks for having me.
How common is teeth grinding among Australians?
I would say that during our lifetime, and it starts from very young, of course, all the way through, probably about 80% or more people will grind at some point of their life. But I think for consistent grinders, it's probably around about 3, maybe 5 to 10% of people are constantly grinding.
So for unless it becomes a permanent habit, is it fair to suggest that those occasional periods where you go through of grinding your teeth are really just related to what is going on in your life at the time? It's more psychological than anything deeper, perhaps.
Yeah, I think there's so many factors when it comes to actually grinding. Like, we've got parents that come in and say, you know what, I've heard my kids grind, and kids grinding is totally different from someone that, say, in their 60s grinding their teeth. So I think the most important thing is to realise that it's not so much how we actually do it, but I think it's how much force goes through those teeth in those periods of time that we do grind.
And let me ask you about that, because my wife is a teeth grinder, and she's gone to the stage of actually having a mouth guard that she puts in, which has stopped it or stopped any damage. But when she was doing it at her worst, I was shocked at how hard I would hear her grinding her teeth at night. I mean, I swear that the sound of that used to wake me up. And they say that you can grind your teeth harder when you're asleep than you would ever dare to do in real life. I mean, how much pressure can the human jaw actually exert? Would we be surprised?
Yeah, I think that you have to think about it when we're eating food. There's always food between our teeth. And a lot of our diet now is not the type of diet that has a lot of hard foods in. So the type of pressure we're putting through our teeth is not that much. When you talk about, you can talk about it in pounds per inch and stuff like that. But when you're looking at the amount of force, they reckon it's between about 5 to 8 times the amount of force going through the teeth when we've got food between our teeth and when we grind our teeth.
Wow. Okay. So it really will, long term, at the risk of stating the obvious, it's bound to do some damage if this is happening and you're not getting on top of it somehow.
Yeah, I think the problems we're seeing now with teeth grinding is, the damage to the teeth. Of course, the teeth get shorter or they wear down over time, but the cracking, the breaking, people lose teeth. They get a lot of jaw pain and things. All of these problems that come about, a lot of patients aren't aware that it's actually the teeth or the grinding that's causing these problems. And headaches and things like that, this connection between our jaws moving around and the headaches and the neck pain and things like that can sometimes be to the fact that the patients are either grinding at nighttime or maybe they're even clenching at nighttime, which doesn't have any sound. And most of the times when they're doing this, the damage is more long-term than short-term.
Dr. Kat, before we talk about how you treat it, we touched on it before in terms of, if people go through stages of grinding, that's one thing, but the permanent grinding, what are the causes of grinding that has become a nightly habit? I mean, I believe stress can be one of them, but a lot of them can just be misaligned things in your jaw or even sleeping position, things like that or something. Is that right?
Correct. Like we talk about children, for example, and a lot of connection between airway issues. People that, look at kids that have problems with their airways, a lot of them actually do grind. And, when we look at, I suppose, grinding overall, there's so many factors that will go through. Our body is so complex. So, changes to hormones, changes to what's happening in our life, in our mind and things like that will have a huge effect. But we also talk about drugs, and we're talking about, drugs that people are taking. There is a connection between some of the drugs people are taking for health reasons that could actually also cause that as a side effect. So the grinding can actually come about when some people actually change meds and things like that. And that's really important to actually know that it's not one thing that's causing the problem. It could be several things.
Do you need to find out exactly what's causing it before you can treat it?
I think the most important thing is prevention, because once the damage is done, it's done. If you break a tooth, crack a tooth, lose a tooth, or you wear your tooth down, the issue is it's very, I suppose, costly and a lot of time to actually fix it. So if you go to a dentist early and they can see signs your teeth are worn, or maybe you're going with sensitive teeth, or you've got a crack or a break on a tooth, they can at least prevent it early on. And then I suppose once it's prevented, you can look at ways to actually then to, I suppose, get treatment at that point that will stop grinding.
Because I guess let me ask that, what I was going to ask you in a moment. What is the treatment? I mentioned my wife was given a sort of a mouth guard, but is that pretty much it, or is there more to it than that?
I think most of the patients that we're actually seeing, they go through these times of grinding. So I think the guard is probably the best thing to prevent problems. I think with dentists, the hard thing is to know how fast all the damage is going down. So what we normally say when patients come in, where we see some signs of wear, is we can actually take a mould of their mouth, or actually see how the teeth are looking through photos, and over a period of time kind of work out, is this a situation where the patients are grinding their teeth very, very fast, or is it something that they're doing, that we're not causing damage to? So I think prevention is the key first, because then we can avoid all of those problems. But secondly is to check how fast is this going on. If there's symptoms that are going on, like headaches and neck pain or sensitivity from the teeth, or maybe a broken tooth, that's something that we have to treat.
Because I would imagine, while having a mouth guard, a really well-fitting mouth guard, will obviously stop the damage to the teeth, if you're still grinding, you're still putting a lot of pressure on your jaw. So you're still going to have some of those other problems in terms of headaches and jaw ache and that sort of thing. So it's still something that you'd want to get on top of the actual cause, isn't it, in the long run?
Yes, and I think the cause for most people, we talk about some of those causes, and I think most patients will go through a list of stuff thinking, okay, how can I prevent this? And I'll go through things like trying to, for example, get to the point where they're more chilled out, they don't have so much tension in their lives and things like that, and that can reduce it by quite a lot.
Has teeth grinding always been a problem? I mean, were dentists treating this through previous generations, or is it more a symptom of more modern times?
I think that's a hard question, because I think we live in a different world now. I think, the things that we actually go through at the moment are different from what we were doing, say, 10 years ago or more. I think, I think it's very hard to know whether we're doing more of it now. I think we're more conscious of it now. I think people that have headaches and neck pain or sensitive teeth, they're trying to find ways to actually prevent it. So I'm not too sure whether you would say that it's something that's happening more now, or it's something that's been going on for generations.
But either way, I guess it's something you, as you say, you want to get on top of sooner rather than later. Is the onus generally on the patient to come in and report it to the dentist, or do you tend to spot the signs before the patient is even aware of it? I mean, can you definitely spot, when you have a look at someone's teeth as part of an annual checkup, can you definitely spot grinding that could only be caused by grinding of teeth, as opposed to, I don't know, brushing too hard or other potential causes?
Yes, I think the main thing we always see is that most of the patients don't know. So we normally have a situation where parents or partners will actually say, my wife tells me that I grind my teeth, or my husband tells me I grind my teeth. But the signs of grinding we can definitely see. I mean, the cracks on a tooth, the fact that all the teeth wear down, or we see that there's a break on a tooth, that most of this is very clear, and we can definitely see it. And I think nowadays with cameras and things like that, once we take a photo of a tooth or several teeth, and you can see that the tooth is damaged, the patient then can easily see that there's problems.
I appreciate your time this morning.